My name is Dr. David Benversi. I'd like to share with you some of the most effective ways that I've found to help relieve the symptoms and pain associated with carpal tunnel. Now, there are three main therapies that we use in our office that help relieve, and they're very effective by themselves, but when used in combination, they're extremely effective in helping with the pain and symptoms associated with carpal tunnel. Those three therapies are the chiropractic adjustment, electrical muscle stimulation, and also active release. Now, with regards to the chiropractic adjustment, there are a couple of main things that we're looking at helping with the chiropractic adjustment. One is we're going to be looking at affecting the joints. Secondly, we're going to be helping affect the nerves in those areas. And those are the main factors that we're looking at with the chiropractic adjustment with regards to carpal tunnel. Now, with the bones or the joints in those areas, when we're having a lot of pressure or compression on those joints, there's little signals or sensors in between those joints, and if those are being pressed too hard, they're going to create pain. So if we can essentially relieve that tension in those areas, it's going to help make sure that those bones and joints are moving and functioning better. The next thing is with the median nerve that we typically have involved with the carpal tunnel. And when we can, again, adjust that wrist and make sure that those bones are functioning better, a lot of times that will free up extra space for that median nerve to flow through that carpal tunnel and not have any pressure applied to that nerve itself. So that's one of the very effective reasons, or the reasons why we use the chiropractic adjustment in that area. The next thing we're going to talk about is the electrical muscle stimulation, and that's going to help out in, again, three main factors. It's going to help out with the pain in that area, it's going to help out with the muscle spasm and tightness in that area, and it's also going to help out with the inflammation as well. With regards to the pain, when we're applying that electrical stimulation through that area, it's basically acting as a nerve blocker to that pain in that area. So that pain signal is not even getting sent to your brain at all. So it effectively helps reduce the amount of pain in that area. The second thing it does is it helps reduce the tension or the muscle spasms and tightness. And again, when we have that mild electrical current going through that area, it is effectively reducing the amount of tension and relaxing those muscles so that things are able to move and function better in that area as well. And lastly, with regard to the electrical stimulation, we're going to be talking about the inflammation in that area. And one of the main problems we have is when we're going through that carpal tunnel, if we have any inflammation at all, that's going to be reducing the amount of space that that nerve or that median nerve has to go to travel through that area. So when we are applying that electrical stimulation, it's more or less having a mechanical effect to sort of sweep out that inflammation or help clear that inflammation out of that area, effectively reducing the pain and allowing more area for that median nerve to go through that carpal tunnel and function much better. And lastly, the active release is again going to be working on breaking up some of the scar tissue that might be built up around that median nerve. And again, when we're looking at the carpal tunnel and the symptoms itself, a lot of times there's scar tissue that's built up in that carpal tunnel itself, which is comprised of the 8 bones in your wrist and also that ligament that goes across there to create that tunnel. So if we have scar tissue that's getting built up in that area, it can reduce again the space that is allowed for that median nerve to function and go through that area and be able to work and function pain-free. So with the active release, we basically are taking a contact on that median nerve and going through ranges of motion and breaking up that scar tissue so that the scar tissue is more or less reduced and that space allowed for that median nerve is increased as well. So when we typically treat patients with carpal tunnel syndromes, a lot of times they're going to tell us how they have a reduction in the pain, they're going to have an increase in the range of motion in those areas, and they're also going to have a reduction a lot of times the muscle spasm, as well as that numbness and tingling and sometimes that burning sensation, as well as sometimes even an increase in the muscle strength in those areas, because those are all symptoms associated with that carpal tunnel syndrome. Now, when people are able to experience this, they're obviously going to be able to do things throughout their day that they haven't been able to do in such a long period of time. One of the main things is their ability to work. A lot of times people with carpal tunnel syndrome are not able to perform their activities at work that they were supposed to do, if at all, because a lot of times it involves either grip strength or using fine motor skills to perform those jobs, or to be able to type at work without having pain. Then with regards to being able to do activities of daily living without pain or having any of those symptoms, they're able to comb their hair, do things above their head, and also be able to grip the things that they need to in life, as far as gripping a comb to comb their hair, for example. And lastly is their ability to sleep better at night, because a lot of people that have carpal tunnel syndromes, they are not able to fall asleep at night just because of the symptoms that are associated with that. So they're able to fall asleep, stay asleep, and sleep more restfully throughout the entire night, and just have a better overall sleeping experience. So if you're in pain, we'd love to help. Give our office a call at 618-519-9334.